The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we're going to have a really wonderful conversation with two women who are dealing with Alzheimer's and dementia all across the state of Montana. We're going to speak with Kyla Rock, who is the program manager for the Alzheimer's and Dementia program at the state of Montana. And we're going to talk to Melanie Williams, who's the program director for the Montana chapter of the Alzheimer's Association. Lots of really important information coming up, so make sure you stay tuned because you're not going to want to miss this.
Can you say ombudsman?
Bidsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Like many areas in Montana, Helena is nearly surrounded by forest and is at risk of a devastating urban fire. Wind-blown embers from wildfires have ravaged communities like Denton, Montana, and Boulder, Colorado. Now is the time to prepare your home for wildland fire, no matter where you live. Be aware and prepare. Make you and your community a safer place. Visit firesafemt.org, paid for by FireSafe Helena and aired by the Montana Broadcasters Association.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Katie Lovell, and today we are speaking with two really important women in the state who are dealing so much with Alzheimer's and dementia. Kyla Rock, who is the program manager for the Alzheimer's and Dementia program at the state of Montana, and Melanie Williams, who is the program director for the Montana chapter of the Alzheimer's Association. Ladies, thank you so much for being here. It's really wonderful to get to meet you in person instead of just over Zoom. So I've seen your little faces in little boxes, but never in person. So it's wonderful to meet you. Thank you so much for being here. Kyla, you have a new and incredibly interesting job. Tell me a little bit about it.
Yep, so I just started in January working on the BOLD grant, which Montana was awarded at the end of last September through the CDC, Center for Disease Prevention and Control. Control and Prevention. So I started in January, and the BOLD grant is the Building Our Largest Dementia Infrastructure.
Okay.
And so what Congress has done is they passed an act in 2018 that supports this funding in order to for states and territories to establish programming across the state to address the growing numbers of individuals experiencing Alzheimer's and dementia. So the whole idea behind it is from working from a public health perspective, so really focusing on reducing that risk that many people have, as far as developing dementia or Alzheimer's.
And how is that different than what we've done in the past? How is a public health approach a little bit different?
So a public health approach is a little bit different in that we're focusing on the 3 levels of prevention, so primary, secondary, and tertiary. So primary really is around educating folks and encouraging healthy lifestyles, healthy brain, activities so that your risk of developing dementia later in life is decreased.
Sure.
That's also related to other chronic disease, which is part of the reason it's housed in the Public Health and Safety Division, is because really they want to mirror some of those other programs that are already in place with diabetes, cardiovascular, tobacco, those types of programming, to really incorporate healthy brain lifestyle into all of that. And so it is a little bit different because it tends to be, historically a lot of things within our country is very reactive, right? I mean, it's all very much a medical approach. And so we really want to shift that focus and that paradigm a bit in order to ensure that we're trying to prevent some of these things from happening down the road. There's some interesting data that says that if we can really do an aggressive public health approach, we can decrease the numbers of people experiencing Alzheimer's or dementia by like 1.2 million.
That's amazing.
Which is pretty significant. So really getting that education and knowledge and awareness out there is super important.
And Kyla, you're doing this work as part of the Montana Dementia Coalition, or in partnership with. Can you tell me a little bit about that group?
Yep, absolutely. So the grant really is, it's a 5-year grant, and the first year really focuses on establishing or maintaining and sustaining a statewide dementia coalition. Luckily, Montana actually already had one in place, which is kind of great. So currently now it was formerly known as the Montana Alzheimer's State Plan, and now they have shifted the name to the Dementia Coalition. So they've been in existence since 2014. And done a lot of great work, creating materials and resource guides and things like that for folks. I actually just saw a commercial the other day that was that they helped to support as well. So they're out there doing some great things. So really the idea behind the coalition and having a statewide coalition is that we make sure we've got statewide partnerships and representation so that we've got all the voices at the table to help us create and figure out a plan that's going to work for Montana that we can implement down the road.
And you are involved in something called the Healthy Brain Initiative. Tell me a little bit about that.
Yep. So one of the reasons that Alzheimer's Association and myself that we're working so closely together is historically CDC and Alzheimer's Association have had a very close working relationship. In 2005, the Congress actually began working specifically on addressing the growing numbers of people experiencing Alzheimer's and dementia. And so that created, helped to sort of jumpstart this relationship between Alzheimer's Association and the CDC in order to figure out kind of plans and maybe create a framework that states and communities can work from to address the issues. And so what they did is they created this Healthy Brain Initiative, and it was initially created in 2005. And so they've redone and so essentially it's a roadmap series that they've done. And so they have sort of made updates over the years. There's also a Healthy Brain Initiative specific to our tribal communities as well.
Wonderful.
So it really creates some action steps that communities and health departments and states can take in order to work with partners, affect policy, and make sure that we're doing things to help support not only public health for people's physical well-being, but also their cognitive health as well is the focus.
What's the plan for Montana moving forward?
So moving forward, at this point we are in the first year of the grant, which really heavily focuses on the coalition. So within the coalition, we are going to establish a steering committee that is specific to the grant to work towards those goals and objectives within that grant. So the committee is going to consist of partnerships with various stakeholders across the state that provide services. So, for example, primary care clinics, colleges and universities that are training the workforce, as well as areas the offices on aging, local health departments, all of those different partnerships, as well as those individuals that are more highly effective and maybe have some health inequities, so tribal communities and LGBTQ population and frontier and rural is a big thing in Montana. So that's kind of where we're at with as far as the coalition goes.
Wonderful, Kyla, thank you so much. When we get back, Melanie, I want to go to you. So make sure you stay tuned because we've got lots more information about what's in the landscape for Alzheimer's and dementia in Montana.
Perhaps our regular viewers have noticed that we've been missing a host for the last several months. In July, our favorite person, Kimmy Everman, unexpectedly passed away, and we'd like to take a few moments now to share some memories that we have of her.
For many of us, watching Aging Horizons with Kimmy as the host was like talking to a friend, and for Kimmy, that's exactly what it was. She cared about all of the viewers of Montana on Aging Horizons as if they were her personal friends. She wanted each of us to live the best possible life and connect to as many services as possible. She had no greater joy in life than connecting advocates to others that could help Montanans across the state with problems that they maybe didn't know as much about. Losing Kimmy was a great loss to the state of Montana, but the work that she did will live on in the hearts and minds and Rolodexes of so many of us at the state.
So working with Kimmy was always a very fun experience for me. She lit up a room with her smile, and I loved her giggle. She had this giggle that was the cutest, most happiest spreading of joy that I could describe. She also was very passionate about her work, about helping veterans, and about her dog Sophie.
Kimmy's been my friend, my coworker, and my mentor for over 20 years. She has taught me so much about not only Medicare, but working with people. She had a great sense of compassion and love, especially for veterans, animals, and the underdog. She loved working with seniors and people with disabilities. That was her heart. She will be greatly missed.
Aging Horizons has been on the air for over 30 years, and I've had the pleasure of working with these wonderful ladies and everybody in senior long-term care that length of time, including Kimmy Everman. And whenever we got done with the show, I just loved her laughter, which everybody's commented here. It was like we're getting away with something. Isn't this fun? And I will sincerely miss both that and her.
Welcome back to Aging Horizons. Today we're speaking with Kyla Rock, who is the Program Director for the Alzheimer's and Dementia Program at the state of Montana, and we're also speaking with Melanie Williams, who is the Program Director for the Montana chapter of the Alzheimer's Association. Melanie, it's time for you. Let's put you on the hot seat now. Tell me a little bit about your position with the Montana Alzheimer's Association chapter.
So I am the program director, and my main pillar or responsibility is called care and support.
Okay.
So I'm really here to meet caregivers where they're at, as well as those living with dementia, and provide support for them in this journey, regardless of where they're at. If it's the very early stages or even the late stages, we want to meet them where they're at, give them resources, education, and most of all, just let them know that they're not alone on this journey, that we're here with them, and we're here to support them through the whole journey.
Melanie, what's the difference between normal aging and then aging with dementia?
As we age, our brains do slow down a little bit, and we forget names once in a while. We misplace things. We forget things a little more easily, and that's normal aging. Somebody with an Alzheimer's or dementia will start to forget things that maybe interfere with their daily living.
Sure.
And one of the big differences is they can't retrace their steps to remember where they left something, or they're mismanaging their medications. They're missing times of events, or maybe mixing up meals even. Maybe they ate breakfast and they thought it was supper. So it becomes more significant, and it's not something that they think of later and remember, oh yeah, that wasn't what I meant to do or what to say, or this is what I was actually thinking of. It seems that part of their memory is just gone, so they can't retrace it. They might start to make some financial mistakes, where in the past maybe they were very meticulous with their bookkeeping, and they might start to just forget things completely that they always knew, like a popular recipe that they followed or a game that they've always played with their family.
Sure.
All of a sudden the rules are gone and they don't remember them.
Yeah. When we're thinking about noticing these symptoms either in ourselves or in others, what are some of the warning signs that we can look out for?
I think some of the things that I just talked about, but also keep a journal and ask, we call it a memory journal, but also ask neighbors, ask friends that are close to them if they've noticed any significant changes in their thinking or cognition. You might notice differences in their problem solving. Maybe before they were able to get the computer back up and going when it froze without any problems, but now they're not able to. They're calling on help for that. So really rallying around them and talking to anybody who's close to them. Sometimes siblings who live further away will come home and they'll see some significant changes.
Sure.
So note all of those and then be ready to talk to their primary care physician or primary doctor, whoever that might be, and just talk about these changes and say that they are something that you're concerned about or worried about.
And when we talk about, noticing these and bringing them up, it's because early diagnosis is really important. Why is that?
So important. There's many reasons. One being that you can really get your affairs in order. And I know some people don't like to hear that. They see that as kind of, well, that's impersonal or that's non-emotional. But it can save heartache later on in the journey when the person no longer can make those decisions. And so just having little conversations along the way about what they want their care to look like. Do they want to stay in their home as long as possible? What are they willing to do? Financially, do they have things in order? Does everybody know where things are and how they're documented? Is there a POA in place, especially with medical and also financial? So looking at those as two different entities. But more than that, early diagnosis can also allow for them to put some behavioral interventions in place.
Sure.
As Kyla was saying earlier, we have learned that there are some things we can do in our everyday life to actually slow the progression of the disease. So if somebody hasn't had the healthiest of habits, they can incorporate some of those things early on and actually slow the progression. It also allows them to educate themselves and their family about what might happen, what this might look like down the road. And so instead of facing it alone, they can surround themselves with people that understand the disease progression and will be there throughout the disease. And finally, really treatment. There are some treatments that have been FDA approved. They're a little bit of a challenge to get in Montana right now, but early diagnosis will allow for treatments. And the earlier you started treatment, the more effective it will be. In the middle and late stages, it's not going to be effective. So we want to really get on those treatments and some of those protocols early so that they can be more effective than waiting till later in the disease.
Are there tips, tricks that people can use when having this conversation, either for themselves or for a family member with their primary care doctor, things that they should be bringing up?
Yeah, we always want to be gentle and kind. That's probably the most important thing, is not to worry about getting to an end point. It might take several conversations. Pick a time of day that person's usually in the best mood and maybe more cognitively clear. Generally that's morning, not always. Find a place that's comfortable for them. And then I would just say come from a place of empathy and concern and compassion, and just say that you're looking out for the best for them, that you love them, you're worried about them, and you want the very best for them. And that's why you're having this conversation, not to be critical, not to create strife. It's really from a place of love and care and concern.
And I know as part of aging and dementia, or Alzheimer's and dementia, we can see some behaviors that start to happen. Why do those behaviors start to happen?
As the disease progresses, so many people equate it to just memory issues. But as I mentioned before, it also affects problem solving. And then emotionally, they get to a point that they can't process their emotions like they used to. So they start to revert in how they process emotions and express how they're feeling. So maybe like a small child, if they're hungry, they don't know how to tell you necessarily they're hungry, so they might act out in a way that you don't recognize, and you're wondering where this behavior came from. And so they really start to use behaviors as a way to communicate what they're feeling when they can't express it anymore.
When we come back, I'd love to talk a little bit about some of the steps that we can all take to maybe improve our brain health, because now that we've heard all of the bad news, I'd like to hear a little bit of good. All right, so make sure you stay tuned, because we're going to give you some tips and tricks to make sure that your brain is in the best shape possible. So stay tuned to Aging Horizons.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support. I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Welcome back to Aging Horizons. Today we're speaking a little bit about Alzheimer's and dementia, and we've got two wonderful ladies with us here. We've got Kyla Rock, who is the program director for the Alzheimer's and dementia part of the state, and then we have Melanie Williams, who is the program director for the Montana chapter of the Alzheimer's Association. Ladies, you've shared some really important information with us so far, but it's been a little bit sad, I'm not gonna lie. I'd love to talk about some of the things that we can do proactively to improve our brain health. Kyla, can you tell us a little bit about what we can take, what steps we can take?
Absolutely. So there absolutely, and again, this is why it's in the public health realm, right? There are things that we can absolutely do. There's modifiable risk factors. So we can continue learning our entire lives. So keep that brain active. Maintain a healthy diet and a healthy weight. Get sleep. There's more and more research supporting how helpful good sleep can be for our overall health. Controlling your blood pressure. If you've got diabetes, make sure you're managing diabetes. Smoke-free is a big one. And then certainly be sure that you're protecting your head. We know that individuals that have experienced any sort of traumatic brain injury are also at an increased risk. And so, again, there are definitely steps you can take to decrease your risk of developing.
And Melanie, I know the Alzheimer's Association puts out so much wonderful information. Are there guides, tip sheets that you guys have out that folks could look to for brain health?
Yeah, we do have a new one out that's called Healthy Habits for Your Brain. It's part of the Healthy Brain Initiative, and so it discusses what Kyla was just talking about. We also have several evidence-based education programs. One of them is Healthy Living for Your Brain and Body. And it really goes through everything that Kyla was talking about and talks about the importance of balance in all of those things. So instead of just globbing onto one thing and thinking, oh, I'm going to start eating right, it really is a balance of all of those things. So bringing all of that into your life with moderation, of course. You don't want to overdo it and burn out. And so we have that education program that's available. We can come and offer it to your constituents, to a group, or you can do it on demand on our website as well.
Wonderful way to get that information out there to all sorts of groups. And then Kyla, you said something earlier that I thought was really interesting, was about changing the focus from reactive to much more of a proactive approach. What does that mean?
So again, like we've talked about, this healthy lifestyle, these healthy habits for your brain, and healthy habits for your brain are good for your whole body, right? I mean, this is going to help improve any risk of heart disease or diabetes or developing any of these other chronic disease things that we see that are very common. So that's the other piece that the grant does focus on, and that this work does focus on, is preventing unnecessarily hospital ER admits or anything like that. And so when we're doing some of these things, when we're working closely with our primary care providers, when we're connected with community resources and things like that, we can help to reduce some of these numbers and maybe get things in place that can evaluate maybe it's not Alzheimer's or dementia. Maybe there's some other process that may be happening, or an impact of a medication or something like that. And so being proactive about that can down the road maybe help prevent any future concerns or issues that may arise around your memory or cognitive health.
Absolutely. Melanie, I think one of the really important things that you spoke about earlier was the support for caregivers. My grandfather passed away from Alzheimer's, and I know that caring for him really impacted my grandmother's health. Are there steps that we can take to proactively help caregivers as well?
I think we need to recognize that the toll on them is probably almost more than the person living with dementia. In fact, in Montana, we're seeing an increase in depression in caregivers and also chronic disease that they're developing because of lack of caring for themselves. So we absolutely want to make sure that things are in place that are bringing stress and anxiety down in their life, giving them time to go out and do some of these healthy brain activities that we've talked about to keep their health the best that it can possibly be and provide support so that they can take care of themselves and also be a priority. Their health can also be a priority.
Yeah. Ladies, what's next for you? What's next on your agenda? What's phase 2 of this? We're so excited to all of the great work you're doing. What's next?
Yeah, absolutely. Melanie and I have big dreams for Montana. We talk about our pipe dreams all the time. So really specific to the work I'm doing is just make sure that we are getting the representation that we need on the coalition to make sure that we've got the voices to help us create a plan that's going to work for our communities in Montana. So if there is any interest in that, we can certainly get some contact information out. The Montana Alzheimer's and Dementia Coalition website is something that we can provide, and that's how people can reach out if they're interested in maybe participating, whether they've been a caregiver, they work in a community service that supports folks, Area's Office on Aging, I mean, any of those partners. So we're just looking to get that team together so that we can get something planned out and ready for Montana.
Wonderful. If folks want to learn more, where do we go? Where should we send folks who want to know more, maybe have concerns about their family member or just want to read more up on the topic?
We have an amazing, we have an amazing helpline. It's staffed 24/7 with master level clinicians. I called them when I was caring for my mom. They are absolutely incredible. And then we have our website, ALZ.org, with so many resources. Some of the educational programs I talked about are on there, as well as other resources. There's an ALZ Navigator, it's called, where you can go in and it will ask you several questions and then create an action plan. I have so many people that call me and say, I don't even know where to start. And that helps them decide, okay, here's my starting point, because it can be so overwhelming. And then of course they can always call me and I can direct them to services that they might need or support that they might need, or sometimes they just want to talk.
Absolutely. I know, as a family member, how hard and isolating that journey could feel it sometimes. So it's so wonderful to know that there are people like you two doing this amazing work. Thank you so much. It was really good to learn a little bit more about what the state is doing working with Alzheimer's and dementia in the state, and to know that you two are both out there doing this great work. If you are looking for resources, make sure you check out the Montana chapter's website. It is really a wealth of information, and it really has the information that you're looking for. And make sure you keep Kyla in mind in case you're looking to add to your commitments, maybe wanting to join that work group. So stay in touch, and thank you for staying tuned to Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.